Joining us now is Republican Congressman Tom Price from Georgia, also a member of the House Financial Services Committee and himself a doctor. Congressman, thank you so much for your time today. I want to start with that first.
Great to be with you.
I want to start with that first so-called myth that the president said he's debunking. He keeps continuing to say, if you like your plan, if you like your doctor, you can keep it. You say that's not exactly accurate. Why not?
No, it isn't, because in the first 25 pages of the bill that's in the House, if your employer doesn't offer the kind of insurance that the federal government says you must have, which is very specific, then you won't be able to keep the plan that you've got regardless of what it is. So the truth of the matter is that the president is playing fast and loose with the facts, and that's not what the American people want. What the American people want is to make certain that we fix what's wrong with our current system, but preserve what's right. And what's right is 83% of the American people are very happy with the kind of health coverage that they have right now.
And Congressman, you said today in your weekly radio address response that a lot of people, as you mentioned, are happy with what they have, but you acknowledge, and the Republicans acknowledge, there is a need for some reform. What fashion would you like to see that take place?
Absolutely, Shannon. The status quo is unacceptable to everybody. As a former physician, I know how difficult it is to be able to treat patients in this day and age with all of the regulatory apparatus that's in place. We need to make certain that those who are unable to afford insurance have the wherewithal to be able to get insurance. We need to correct the portability problem so that if you change your job or you lose your job, that you're able to take your insurance with you. We need to make certain that medical decisions are between patients and families and physicians, and not with the government in between, which is what the bill that's in the House would do, would make it so that the government stands in between patients and physicians. And we also need to make certain that we address the whole liability issue. The lawsuits that drive up the cost of medicine, drive the practice of defensive medicine, none of them are addressed in the Democrat bills or in the president's bill, and that's not what the American people want. We want to make certain that we productively and actively and positively reform the system.
All right, the issue of public option has come up. It's been in the headlines all week long. A number of Democrats have come forward to say if you don't keep it in the bill, because it's in all three House bills, you're going to lose dozens, maybe 100 votes. Other Democrats coming forward to say, hey, let's scrap the whole thing and start from scratch. Do you think that's at all a possibility?
I think that we've got to move that off the table, because if you have a public option of any variety whatsoever, whether it's co-ops or whatever you want to call it, it is in essence a government program that will not play fair in the private sector. And we know this. Even the Congressional Budget Office, the Objective Congressional Budget Office, said that tens of millions of individuals would be moved from private personal insurance to the government option. And that's not what the American people want. So we've got to take that off the table. That doesn't mean that we can't provide appropriate assistance for those who are having challenges getting insured. We can and we must do that, but there's a way to do it that preserves what's good in our system and doesn't have the government taking over the practice of medicine.
Congressman and Dr. Tom Price, thanks for your time today.